Measles is a viral childhood infection, also known as rubeola, which refers to a contagious viral infection caused by the measles virus. In this infection, red rashes with white spots appear throughout the body, starting from the face and then spreading to the chest and other lower body parts, including feet. Early symptoms of measles include severe fever and dry cough. This disease is very contagious and can transfer from person to person by direct contact or infected air. This disease is even fatal, but death rates are going to reduce throughout the world because of the awareness about measles vaccination. Let us explore the symptoms, diagnosis pattern, and treatment of the disease. What is meant by measles? Measles is a respiratory disease caused by a single-stranded RNA virus. The measles disease virus has only one serotype, as it primarily infects humans and does not cause a disease in animals. In this disease, red rashes appear on the face or behind the ear. These rashes can spread from the face to the chest and then to the whole body. The rash may appear after 14 days of virus exposure. Children and young people could get more. A report by the World Health Organization reveals that almost 48,000 people are hospitalized annually. About 1,000 people from them developed chronic disability. This disability is the result of an encephalitis condition caused by measles. How is measles transmitted? Measles is the most contagious disease. A report indicates that 9 out of 10 persons could get that infectious disease if they are in close contact with an infected person. This virus is transmitted by direct contact with the patient or by respiratory droplets in the air. Due to the measles patient's breath, cough, or sneezing, these viruses spread in the air. The measles virus remains in the air for 2 hours, even though the infected person leaves that place. It's more contagious, so an affected person should isolate himself 4 days before and 4 days after getting that infection. Non-vaccinated persons, especially siblings, should also stay away from the affected person. To prevent the spread of measles, an infected person should be isolated 4 days before and 4 days after the measles. How many stages of measles? This infection occurs within 4 stages, from infection to recovery 2 to 3 weeks. Stage 1. This is an infection and incubation period. It lasts 10 to 14 days after the infection's occurrence. These days, the virus spreads throughout the body. There are no main signs and symptoms in this period. Stage 2. This is known as non-specific signs and symptoms. This stage lasts up to 2 to 3 days. This stage includes mild to severe fever, runny nose throughout all stages, and continuous cough. Stage 3. This stage is known as acute illness and rash. Small reddish spots are formed. These spots appear in clusters and turn the whole skin reddish. These start from the face of the infected person and could lead to arms, chest, thighs, legs, and feet. At that stage, the fever of the infected person could reach 41 degrees Celsius. Stage 4. This is known as the recovery period. This is about the last 7 days of measles. The rash of the body becomes clear, starts from the face, and ends at the legs and feet. Other symptoms like cough may last a further 10 days. Describe the causes of measles. The main cause of measles is a virus found in the infected person's nose and throat. Someone can get the measles virus by direct contact with the infected person. A person can transfer the measles virus into the air through his respiratory droplets, and the others can take this virus from the infected air. What risk factors could lead to measles? Some risk factors that could lead to mass activity include being unvaccinated and having vitamin A deficiency. Unvaccinated, a person who is not vaccinated against measles, has a chance of getting this infection. Vitamin A deficiency, a person who lacks vitamin A is more prone to measles disease. Vitamin A plays a critical role in maintaining and supporting a healthy immune function. Therefore, vitamin A deficiency makes an individual susceptible to infection, including measles virus infection. Moreover, vitamin A deficiency increases the disease severity of measles and the chances of complications like vision problems, diarrhea, pneumonia, and others. What are the symptoms of measles? A measles infectious person experiences its symptoms 10 to 14 days after getting the measles virus in his body. Other symptoms include high fever, dry cough, runny nose, sore throat, and inflamed eyes. Koplik spots are also formed, in which small white spots appear with white-blue, ESH center, and red outer boundaries. How is measles diagnosed? The doctor considers measles from a febrile rash illness in a patient. Some clinical measles symptoms are also considered, especially if a person travels internationally. Laboratory confirmation could also be done to diagnose measles. The tests detect measles-specific IgM antibodies in serum and detect real-time polymerase chain reaction, RNA, in the respiratory specimen of the measles-infected person's body. These tests are performed by taking laboratory serum samples and throat swabs from suspected persons. Measles virus could also be detected from urine tests. Some molecular analysis could be done to determine the transmission pathway of the virus. This analysis can determine the genotype of the virus. This is the only way to distinguish between wild-type measles and rash-causing viruses. Describe the effective treatment of measles. There is no particular treatment for measles. Some care tips should be taken to relieve the symptoms of this disease and let the patient be comfortable. Enough water intake may fulfill the body's water requirement and could replace the fluid lost during diarrhea. Some antibiotics may be recommended to treat ear and eye infections. All children or adults are recommended to take 2 doses of vitamin A supplement in a gap of 24 hours. This could fulfill the deficiency of vitamin A, which may occur in a nourished child. These vitamin A doses may also prevent the person from eye damage and reduce the death of measles patients. Which complications are associated with measles? Here are some complications that could occur with or after the measles. These complications are otitis media, bronchopneumonia, diarrhea, and laryngotracheobronchitis. In some cases, measles even causes serious illness that needs hospitalization. Ear infection is one of the most common complications of measles. Measles could lead to acute encephalitis, which may cause serious brain damage. This complication occurs in 1 out of 1,000 measles patients. This complication may occur after measles or some months later. Sometimes, children with measles could experience serious respiratory or neurological issues, which could cause death. After 7 to 8 years of measles, serious characteristics like seizures or intellectual deterioration could develop. These may develop a fatal disease, subacute sclerosing panencephalitis. In pregnant women, measles can cause severe issues like premature birth or even fetal death. Who are people at risk of getting measles complications? Some people can get serious complications with measles. They are infants under the age of 5 years of children, adults which are under the age of 20 years, pregnant women, people who have weak immune systems or other diseases like hepatitis, leukemia, or others. Could measles be prevented? The U.S. Centers for Disease Control and Prevention recommended that measles be prevented by taking a vaccine at an early age or in childhood. The first vaccine for measles was reported in 1963. The measles vaccine is given in a combined form with the measles, mumps, and rubella vaccines. It is recommended to be given in 12 to 15 months. Its second dose is between 4 to 6 years. This vaccine, 97%, prevents the measles throughout the life. Here are some suggestions regarding vaccination. If you have to travel internationally and your child is 6 to 11 years old, talk to your doctor about the vaccination for your child. As for foreign travelers, children must get vaccinated at 6. If a child has not gotten 2 vaccine doses on time, they need to take the vaccine 4 weeks apart. If you are an adult but do not have proof of immunity to measles and belong to a college or hospital, then you are at higher risk of getting measles. The proof of immunity against measles should contain written documentation, immunity lab test evidence, and lab test evidence of having measles in the past. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.